Good afternoon, Berkeley. Thank you for joining us for this live town hall meeting on the City of Berkeley's response to the COVID-19 crisis. I'm your mayor, Jesse Arreguín. I'm proud to represent the City of Berkeley. And we'll be joined this afternoon by our city manager, D. Williams-Ridley, as well as the City of Berkeley's health officer, Dr. Lisa Hernandez. And I think it's important to note as we start our conversation this afternoon that Berkeley is unique from many other cities in Alameda County and in the state of California, in that we have our own health department that provides public health services to the residents of Berkeley. And as you know, health officers throughout the Bay Area region on March 16th issued a shelter-in-place order. And the City of Berkeley was one of those public health departments that issued a shelter-in-place order. And so we are adopting on a local level regulations and protocols to keep our community safe. And so we're very fortunate to have Dr. Hernandez join us for this discussion this afternoon. This is a very difficult time for not only our city, but also our country and our world. Many people are deeply concerned about how COVID-19 will not only impact them, but also impact their family, how it will also impact our local businesses. We are seeing a dramatic decrease in business at our local businesses. Some businesses have had to lay off their employees. Our arts organizations are shuttered. Our parks are closed. This is impacting not only the quality of life of our residents, but also our local economy. And I want you to know the City of Berkeley is working as hard as we can to not only work to keep our community safe, but also to support our local businesses and our nonprofits during this very difficult time. So this afternoon, we're going to touch upon a number of issues, including what you can do to prevent the spread of coronavirus, the number of cases in Berkeley and our shelter-in-place order, the City of Berkeley's response to the COVID-19 crisis, and what services are still being provided to local residents, and what services and facilities have been closed as a precaution to ensure that our community is safe and to ensure proper social distancing. I will touch upon our actions that the City Council took last week to implement a moratorium on evictions for commercial and residential tenants, as well as a relief fund that we have launched to provide emergency assistance for our small businesses, arts organizations, and residential tenants who are impacted by this crisis. And then we wanted to open up for your questions. We've already received a number of questions from Berkeley residents that we will be answering throughout this town hall. And then we'll be taking the questions of those people that are on this call as well. And I want to thank the residents of Berkeley who have joined us this afternoon for this discussion. And please bear with us as we are testing this technology. You know, this is definitely a new service, and we look forward to hearing your questions, your ideas. Since the shelter-in-place order has taken effect, we've gotten lots of excellent ideas from local residents about additional efforts the City of Berkeley can take to keep our community safe. And you know, we welcome your suggestions. I just want to say that I'm proud to be Mayor of Berkeley at this time, and I'm proud of our amazing city staff, some of which you'll hear from this afternoon, who have done an incredible job in working to respond very quickly to an evolving situation, to prioritize the health and safety of our community and make sure essential services continue to be delivered to our residents. And I'm also proud of the people of Berkeley who have really stepped up to try to help each other. Whether it's helping elderly residents in your neighborhood get access to groceries or medical care, whether it is providing personal protective equipment to local hospitals and to our first responders. The people of Berkeley really stepped up and not only have been thinking about the health and safety of their families, but the health and safety of our broader community. And I think during these difficult times, this is when our community can really come together and really show our strength and our resiliency. And in our 140-year history, we've had many challenges. We've had earthquakes, we've had fires, we've had protests, but this is no doubt the most challenging situation that we have ever experienced. And I am proud of our staff at the City of Berkeley and the people of Berkeley for everything that they've been doing to respond to this crisis and to act quickly to protect our community. We actually, by taking action on March 16th to implement the shelter-in-place order, we were ahead of many other states and many other communities. And I think that will have the effect of saving lives. So at the end of the day, our focus is saving lives, supporting our local businesses, supporting our nonprofits, and supporting our residents during this difficult time. So I look forward to your questions today, and I want to introduce our presenters who have joined us. We're joined by our City of Berkeley Health Officer, Dr. Lisa Hernandez, who we'll hear from very shortly, and our City Manager, Dee Williams-Ridley. And Berkeley has what's called a city manager form of government, where the City Council is a legislative branch of the City of Berkeley and hires our city manager, provides oversight of the city manager, and also adopts the city budget and legislation that the city manager implements. And so we're fortunate to have an amazing city manager who's been working tirelessly over the past several weeks. Actually, we activated our emergency operations center in late January, before many of these cases peaked in the United States. And we have been out ahead working to not only follow this evolving situation, understand the data and the science, but also to put in place measures to protect the health and safety of our employees and the residents of Berkeley. And so with that, I'd like to turn it over to our City of Berkeley Health Officer, Dr. Lisa Hernandez. And Dr. Hernandez, I'd like for you to talk a little bit about what is COVID-19? What are the symptoms? How can people prevent spread and infections? What are the current number of cases in the City of Berkeley? And then in closing, if you could talk a little bit about the shelter-in-place order that you promulgated on March 16th. Dr. Hernandez. And Dr. Hernandez, if you can unmute your, great, thank you.
I got it. I wish I was more technically advanced like you yourself, Mayor. So good afternoon. COVID-19 is a novel virus that we have been aware of since January of this year. And it's a virus that's, when we talk about novel, that means it's a virus that we've never experienced before in humans. And so that's the new part of this disease. What we do know is what common symptoms people have. Those symptoms include fever, so a high fever, cough, and shortness of breath. About 80% of people with COVID-19 have those common symptoms. It's a little tough because it sounds very similar to the flu, but it's different than the flu because it's a new virus. There's not a vaccine and there isn't currently a cure. However, there are basic things that you can do to protect yourself. And they sound very mundane, but these are core disease control protective things that you can do every day. One is washing your hands. Wash them as often as you can when you touch objects out in public. When you come home, wash them 20 seconds with warm water. If you don't have access to water, you can use a hand sanitizer. The second thing you can do is avoid touching your hands, your face, and mouth. Again, that's another protective measure. Staying away from people, doing social distancing in public, which means staying 6 feet away from others when you go out to perform your essential functions, and covering your cough and staying home when you're sick. Those are the other measures that you can take. You mentioned, well, we can talk about the cases here in the City of Berkeley. We currently have 19 confirmed cases of COVID-19 in City of Berkeley residents. In Alameda County, there's 204 cases and 4 deaths. There are no deaths in the City of Berkeley. Those numbers represent the confirmed cases. We do know that there are more cases circulating in the community because of the lack of testing. It was slow testing that was available to the community, and we know that there are more cases in our community, and hence why I issued the shelter-in-place order on March 16th. That order was issued to ensure that we had more social distancing, so that we could curb the transmission of disease in our community. That is a science-based measure that has worked for other diseases and actually has worked in other countries for COVID-19. The order is meant to reduce our contacts with any person in the community that we don't usually have contact with in our home. I can talk more about it, but I want to make sure that other people have a chance to speak, especially a city manager.
Okay, thank you very much, Dr. Hernandez, and thank you for joining us. And I know there are a lot of questions around what's next with the shelter-in-place order, how we're working with our local hospitals, or questions about testing, ventilators. So we look forward to getting into all those issues this afternoon.
Great.
So I now want to call on the city manager of the city of Berkeley, D. Williams-Ridley, and Madam City Manager, you can unmute your,
Okay.
there you go.
Thank you.
Thank you for joining us. And wondering if you can talk a little bit about the city's response since late January to this crisis, and what city services are we still providing, and what services are we not, and what sort of facilities have we closed as a precaution.
So thank you, Mr. Mayor, and thank you so much for taking the time to hold the town hall today. I think it's really important for us to get out there and have a FaceTime with our community, even if we have to be in our home to do so. So right now, what we've done over the last 2 months, and it's been an incredible lift for the organization, every single department within the organization has set up and participated in our Emergency Services Operations Center. We have activated everything that you can imagine for our community, with the first and most important thing being looking out for the safety of our community as well as the safety of our employees. And at this time, we have a number of services, a number of essential services that have continued for the city, and there are quite a few services that have discontinued. So I want to give a little bit of framing, because one of the things that happens in an emergency is that employees become disaster service workers. So the city of Berkeley has a little over 1,500 employees, and all of those employees during an emergency become disaster service workers. They can be mobilized to work on various projects and specific things related to the emergency on behalf of the residents and for the residents of our community. At this time, we have over 580 employees that are working either at home, that are working in our EOC, that are also being worked on the front line with essential services. In terms of the services that we still have continuing in the city, and as most folks know, non-essential city services are suspended during this time and under the health officer's shelter in place, and all city buildings are closed to the public with limited exceptions. So I want to go through some of those very high, but all of this information can be found at cityofberkeley.info/coronavirus. So what are the services? So adult mental health, aging services for case management for some of our vulnerable community members, animal services, because the animal shelter has to continue on while we have animals that are that need care and shelter. Birth and death certificates, we have that on an appointment only type basis, so people can call in, schedule appointments, and staff will work with you and or meet with you. Our boards and commissions have been suspended for 60 days. So folks are aware that a lot of our amazing volunteers in our city, we've suspended those programs for 60 days, but our council under our budget, Agenda and Rules Committee will revisit that on, I believe it's April 13th. So we'll look forward to seeing how we can lift up some of the important work that still needs to happen that is essential. Construction and building permits, you can go online and find a number of information about things that are allowed in the community still, activities that we're still doing, and building and safety services that we have online. And we've done a great job in lifting up a lot of online services for our business community. Hand washing stations, we've installed public hand washing stations in areas with a high need. We deployed over 22 additional hand washing stations throughout the city of Berkeley. As most people know, our parking enforcement is still enforcing parking throughout the city, but that enforcement is pretty limited. Red curbs, fire hydrants, disabled parking, also yellow zone, double parking, bus stops, and especially on days when we have to sweep. And the community's had a lot of concerns about street sweeping during this shelter in place. But it is extremely important for us to make sure that our streets are clean, that we also clear the gutters so that the storm drains are clean, so that we can get, have the water drain down as we're seeing rain today and possibly tomorrow. So it's really important to keep the street sweeping folks out, keep our enforcement folks out there so that they can make sure that the streets are clean. So please move your vehicles, and we're trying to offer as many resources as we can. I don't want to take up all the time on this video call, but as most of you know, our parks, some of our playground equipment in our parks is closed, as well as tennis courts, basketball courts, playground equipment. And there's a lot of reason and purpose for that. Of course, touching surfaces is how the virus can be transmitted. So we want to be really careful. Reducing our footprint is the most important thing right now, and having less of a community footprint out there. Stay home, take time with your family, only come out when necessary. Thank you, Mr. Mayor, and I can turn it back over to you. Thank you.
Thank you so much, Madam City Manager. Thank you for joining us this afternoon. I just want to address, we have gotten some tweets and emails since we started this virtual town hall. There is a limit on the number of people that can log in through Zoom, and that's 100 people. So I know some people have tried to log in and they're not able to log in, and we apologize for that. But we did ask people to submit their written questions in advance. We have a number of questions that we'll be addressing this afternoon. Those of you that did log in through Zoom, you are in what's called a waiting room. And so I will go to you very, very soon to go to your questions, and we'll go to you live. And then we'll also be addressing the questions that we received in writing from residents. And I imagine this will not be the last time that we do these town halls, and this will not be the last time we'll have to do it remotely, given the shelter-in-place order and the need for us to take precautions and to ensure proper social distancing. So we will ensure that there are additional opportunities to weigh in, and I encourage residents to email my office, mayor@cityofberkeley.info, if you have specific questions or ideas or suggestions around what the city should do to address this pandemic. Before I go to some members of the City Council who are on the line, I'm going to talk a little bit about some actions the City Council took actually on March 17th, a little more than a week ago, to respond to this pandemic. The City Council met in an emergency session to take up several items related to our response to the COVID-19 pandemic. And one of the actions the City Council took was establishing a moratorium on the eviction of residential and commercial tenants for non-payment of rent during this declared local state of emergency. As I mentioned, because we're on health department, we have declared a local state of emergency and issued a local shelter-in-place order. And so during the duration of this local state of emergency, evictions for non-payment of rent, as well as no-fault evictions, owner move-in evictions and other no-fault evictions, are prohibited in the city of Berkeley. And that moratorium also applies to commercial tenants as well, because we've heard from some of our small businesses who are concerned about the fact that they have had to lay off employees or have seen a significant decrease in revenue. Some estimates, there's been a 75% decrease in revenue since this pandemic started, and may have difficulty in paying their rent and are concerned that they will be displaced. And so the moratorium the City Council adopted on March 17th also covers commercial evictions as well. And we, starting this Monday, will be launching our Berkeley Relief Fund that will be providing grants to small businesses, arts nonprofits, and residential tenants who are impacted by this crisis. And if you go to www.berkeleyrelieffund.org, berkeleyrelieffund.org, for information about how to apply and about the Berkeley Relief Fund grant program. And also go to berkeleyrelieffund.org to donate. We're calling on all of our residents to contribute to help grow this fund so we can help as many local businesses and residents as possible. We know that the economic impacts of this pandemic are significant and will last beyond the shelter-in-place order. And so how can we ensure that our businesses are treasured local businesses, which add to the vitality the character of our city, that they can stay open? How can we ensure that our arts nonprofits, Berkeley has amazing live performance arts nonprofits, many arts organizations. We are really a center for arts and innovation in the region and in the state. How can we ensure that our arts organizations can weather this crisis? And tenants who may have been recently laid off and who may be unemployed, or who have seen a decrease in income because their hours have been reduced, or who have to take time off work because they're sick or they have to care for a sick loved one. How can we ensure that they can weather this crisis and that we do not see more people become homeless on our streets? How can we help the unsheltered who are living on our streets? So these are all part of the reasons why we launched this relief fund. And once again, if you go to www.berkeleyrelieffund.org to apply, as well as to donate, you can really make an impact in helping our community get through this crisis and to keep our small businesses, our arts organizations, and our residents in our community. So that's a little bit about the council's action. We adopted a moratorium on evictions that has taken effect. And we also have launched this relief fund, which actually will start on Monday accepting applications. And our goal is to try to get grants out as quickly as possible to qualifying businesses, nonprofits, and residential tenants. The support for housing assistance will be run through the East Bay Community Law Center. And we encourage individuals who are either on the verge of losing their housing or need additional housing assistance to go to the East Bay Community Law Center's website, ebclc.org, or call 510-548-4040. That's 510-548-4040 to speak to a housing counselor and to inquire about how you can get some of this emergency housing assistance. I wanted to touch upon some of the actions the state has taken. On March 16th, Governor Newsom signed an executive order which allows local governments to be able to adopt local ordinances to prohibit evictions during the declared state of emergency for both residential and commercial tenants. And as I mentioned, immediately after the governor's executive order on Tuesday, March 17th, the council adopted the urgency ordinance to prohibit evictions in the city of Berkeley. And we are working to try to get information out to residential tenants, commercial tenants, and property owners about these regulations and about the rights and responsibilities of owners and tenants under this legislation. Governor Newsom also yesterday signed an executive order that has the effect of delaying the enforcement of evictions. Now, there's been a lot of advocacy statewide for a statewide moratorium on evictions, as well as a freeze of rents statewide. And Governor Newsom took action short of that this week through his executive order. His executive order still allows cities like Berkeley to adopt local legislation, which we've done, and tells sheriffs and courts that they are not to enforce eviction orders that are issued. So while it does provide some relief, there's clearly a need for additional support on the statewide level, and the Berkeley City Council is continuing to advocate for state legislation to ban evictions, commercial and residential evictions, in the state of California during this declared state of emergency. So that's a little bit about the actions City Council's taken to provide eviction relief and housing assistance for our neediest in our community. So before we go to questions, I want to call on a few elected officials that have joined us. And I want to first go to Judy Appel, who's president of the Berkeley Unified School District Board of Education. And we are going to make Ms. Appel's line live. And very appreciative that Ms. Appel's joined us. We've been working in partnership with the school district these past several weeks. And I know Ms. Appel's joined us. She's able to answer any specific questions relating to the school district and the school district decisions in response to this COVID-19 crisis. So, okay, well, I think Ms. Appel will be joining us back on again. Why don't I go to Councilmember Susan Wengrath? Okay. Well, we had a number of council members on the line, and when they come back, we'll call on them to just say a few words. And we have Councilmember Ben Bartlett, I believe. So if we can turn his line on. There's Councilmember Bartlett. Councilmember, could you unmute your line? Councilmember, your line is
okay.
muted.
Perfect. How's that?
Great. So I just want to give you a few opportunities to say a few words to our residents.
Test. It should be live.
You're live.
Okay. Well, thank you, and thanks for having me, Mr. Mayor, and thanks for hosting this town hall. And I want to thank everyone else for tuning in. It's been said a few times now that this crisis is definitely going to test our mettle as a community and as people. And it's imperative that we come together to get through this crisis. And what I mean specifically now, as it starts to hit home now, the nurses at Alta Bates reached out to my office just yesterday asking for help. They need basic stuff. They need shoe coverings. They need N95 masks. They need isolation robes. They need it all. And so I'm making the call for everyone to reach out in their communities to network and get donations to this hospital, because if our first responders get sick, we're all getting sick. So we got to come together, and it's going to be tangible actions like this that make a difference in how we survive this mess.
Thank you so much, Councilor, for joining us. And before we go to questions, if we can activate Judy Appel's line. Hi, President Appel. Thank you for joining us. I think you're there you go. Hi. Joining us.
Thank you for having this, Mayor Arreguín. This is really helpful. And if anyone
I think you're there you go. Hi.
Hi.
Joining us.
If anyone
Thank
has
you
any,
for having this, Mayor Arreguín. This is really helpful. And if
anyone
I think
has
you're there you go. Hi.
Hi.
Joining us.
if anyone
Thank
has
you
any,
for having this, Mayor Arreguín. This is really helpful. And if anyone
I think
has
you're there you go.
can we
Hi.
stop it playing over and over?
Thank you for having this, Mayor Arreguín. This is really helpful. And
Are you there? Judy?
I am
thank you for
here,
having
but
this,
I don't know
Mayor
why it keeps doing
Arreguín.
that
This is
over and
really
over
helpful. And
Are you on Facebook? Are you there?
again. Well, I am. Oh,
Judy?
I am also on
I
Facebook.
am here, but
I don't know why it keeps doing that
This
over
is
and
really helpful.
Okay, why don't we come back to you if that's okay? And please, everyone, forgive us as with these technical difficulties. It's the first time we've done this. But so we'll come back to you, Judy. Why don't we that's okay? That's okay. And please, everyone, forgive us as with these technical difficulties. It's the first time we've done this. But so we'll come back to you, Judy. Why don't we that's okay? That's okay. And please, everyone, forgive us as with these technical difficulties. It's the first time we've done this. But so we'll come back to you, Judy. Why don't we that's okay? That's okay. And please, everyone, forgive us. It's the first time we've done this. Okay. Well, thank you, everyone, for your patience as we're testing this. Social distancing does require us to have to test new technology and new ways of communicating. And sorry for the hiccups, but I really appreciate your patience. So we'll go back to School Board President Judy Appel shortly, but I want to go now to start questions. I know we have a number of people waiting on the line, and why don't we go to the first person, Tamara. Welcome, Tamara. I think we're trying to connect with Tamara. While Tamara is joining us, let's go to Kim Anna. Kim, welcome.
Hi, Jesse.
Hi.
I'm just
Hope you're staying safe.
yes, thank you so much, Jesse, for doing this, and I really appreciate all the things that you guys and the whole city is doing. We're really pulling together. I'm really proud of everyone.
Thank you. Do you have any questions or?
Do we know how many cases we have?
I'm going to turn to Dr. Hernandez
Okay.
for that question. Thank you.
Okay.
Hi there. We currently have 19 confirmed cases in the city. In Alameda County, there's about 204 cases.
And does anybody know like how this affects Alta Bates?
Are you asking about how these current cases are impacting Alta Bates or just in general?
Yeah, that both, yeah.
Some of the cases are hospitalized, some are not, and they are hospitalized in hospitals throughout the region. Our numbers reflect the number of cases in Berkeley residents, and they can be, if they're hospitalized, they can be located in various hospitals throughout the region. In terms of how we're working with Alta Bates in general, we have a daily meeting with the healthcare providers in the community, both the providers that provide care in the community, like primary care providers, as well as Alta Bates Hospital, to see how they are doing, what their needs are, to ensure that they have what they need to be able to care for our residents. And if we don't have the resources, if they don't have the resources, we are trying to locate the resources in the region through the emergency regional, region 2, which includes City of Berkeley emergency partners.
Thank you, Kim. If it's okay, we're going to go to our next caller, and thank you for joining us. So Tamara, thank you for joining us. We're going to go to you now.
Hello?
Hello, yes, hi.
Yes, my questions are on the relief fund,
Yes.
Berkeley Relief Fund. What is the oversight process for the relief fund distribution? Who are the recipients of the fund, and how do we know that the money goes directly to those who lost their income?
So all great questions. We actually just this week finalized the criteria for the Berkeley Relief Fund, which is going to be administered by our city. Well, the assistance for small businesses and for arts organizations is going to be administered by the City Office of Economic Development, which are our staff that work with our local businesses on a daily basis, as well as in developing our local economic development policy. We have developed criteria, which we will be sharing when we launch the fund this Monday. It will apply to businesses under 50 employees. So the goal is to make sure that the relief is going towards smaller businesses. In fact, the vast majority of businesses in Berkeley are businesses of 5 employees or less, surprisingly. So, we want to make sure we are targeting this assistance for businesses that really need it. In addition, those businesses will have to be current with their business licenses. We developed a set of criteria to ensure that we are able to ensure that the funding is right sized for the need of a particular organization. So some of that criteria does include looking at issues of geographic and racial and social equity, as well as, what are the gross receipts and what have been the decrease in gross receipts that businesses have received, and really just trying to understand what the need is and how to right size that assistance that need. So all that information will be made available starting this Monday when we launch the relief fund process and the application process. And it will be overseen by our city staff, our Office of Economic Development. And the goal is to provide reporting to the City Council about how the funds have been spent. The residential portion, the assistance that will be provided to residential tenants is going to be administered by the East Bay Community Law Center, which is a nonprofit organization that provides legal services to low-income tenants and moderate-income tenants in the East Bay. We actually currently work with the East Bay Community Law Center to administer a similar fund. And the criteria will be very flexible to make sure that it's not just providing rental assistance if you are on the verge of eviction, but additional housing assistance if you need help with utility bills, for example, or other housing costs. The funding will be flexible to enable people to have access to those resources. We will be setting a maximum of $10,000 per individual per grant. It's a one-time grant. And in addition, there's a number of criteria, including documentation that has to be provided to show that the tenant is facing hardship and does need this assistance. So that's just an overview, and the goal is to provide ongoing reporting to the City Council about the recipients and how these funds are spent to ensure transparency. And once again, the specific criteria will be made available to the public this Monday.
What about freelancers?
So if you are a business, as long as you're a business of under 50 employees, you are eligible for the relief fund grants. I will also note that the legislation that was just adopted yesterday by the Congress does allow independent contractors to be eligible for unemployment assistance. And in some cases, 1099 employees would also be eligible to apply for the relief loans that the Small Business Administration are going to be made available. So there could potentially be federal resources available, and the legislation does allow independent contractors to apply for unemployment assistance.
Let me further clarify my question. Let's say, and by the way, I'm personally employed, have a steady income. I care about my community. So those are my questions for the sake of others. Let's say I'm a small business. I have 5 employees. I applied for a grant. How does the city control that I, as a business owner, do not take all the money for myself, and the funds actually will be going to the employees, the ones who are sitting at home not being able to do their jobs right now without any income?
So I'm going to go to the city manager, if you might be able to help answer. I think it's a good question. How can we ensure that these grant funds are actually going to, help offset the impact on employees and help these businesses recoup costs because they're impacted by COVID-19? If it's okay, I'd like to go to the city manager to help answer the question.
Sure.
And then we're going to go to our next caller thereafter.
So of course, this is new for us, and we're launching it on Monday, and we do have explicit criteria. So what I think businesses have been trying to do, and it has been an amazing push from our businesses locally, is they are fighting for their employees. They are absolutely looking for ways to keep their employees employed and to make sure that they're able to actually survive through this health emergency. So in terms of looking at specifics, now employees are going to have a number of available resources to them in addition to what their employer can provide. Right now, there's been an increase of over $600 to $800 under unemployment through the federal government, as well as state unemployment, and employees are able to apply for unemployment as well, especially for those that have been laid off. I also think with the stimulus package, for those that have filed their taxes in 2018 or 19 and they qualify, they'll also be eligible for $1,200 depending on income. So there will be some resources beyond what the employer is going to provide. But again, employers are going to have the opportunity to look at what the needs of the business are going to be in terms of making it sustainable and bringing it back to life. And that includes employees, but the dollars will probably be spent with both. So I would just caution to say that it's not explicitly for employees, but it's certainly for the business and the employee. And again, additional resources for employees are available. Thank you.
Thank you, Tamara, for joining us. And we're going to go to the next caller. And I welcome, if you have any other additional questions, please contact my office. And once again, the application and the criteria will be available on Monday for the Berkeley Relief Fund. And we encourage you to apply. So I understand the next person we have is Councilmember Cheryl Davila. Welcome. And Councilmember, you are live. Councilmember, is your phone unmuted? Councilmember? Okay, well, while we're waiting to get her her line active, we received a number of written questions. I'm just going to read a few, and if we, I'll do my best to answer if some of our experts can answer. So, first question is, the first question was around access to green space and what the city of Berkeley might do to support East Bay Parks to keep our parks open. I'm happy to address that. As everyone knows, the East Bay Regional Parks District this week announced that they are going to and have since then closed many recreation facilities at their parks throughout the region, but have kept trails, paths, and open space open for public access, consistent with the shelter-in-place directive, enabling people to go outside to get fresh air and exercise. So I strongly support keeping paths and open spaces accessible to people so people can walk their dog or get some fresh air or peace of mind. And I will continue to advocate to ensure that these open spaces are accessible for everyone with proper social distancing. I think it's important to note that with proper social distancing, keeping at least 6 feet apart from people to ensure that people do not contract coronavirus. So while the shelter-in-place order does allow you to go out and to walk your dog or to go to a grocery store or to get exercise and fresh air, we still ask that people exercise proper social distancing of at least 6 feet. That is really essential. And I will now go to the city manager. And Madam City Manager, we received another question about why we close schools and playgrounds. And would the city consider reopening schools and playgrounds at this time? And wondering if you might be able to address that.
Yes, so the city of Berkeley, thank you. So yes, the city of Berkeley did not actually close schools. So those decisions were made by the school board as well as superintendents around our jurisdiction. So that was a private decision, but it was done in consultation with health officers around the region. So it was a very informed decision. So we didn't have any authority over closing schools. We do not have any authority over reopening the schools, but I think it was an important decision and a very good decision for our city. Clearly, the real goal here is to reduce the footprint. So as we start thinking about parks and playgrounds and the type of exposure that people can have at a park, big playground equipment, slides and jungle gyms, those types of things can keep a virus on the surface for a number of days. We can't go and clean them as regularly as we would like behind each time a child plays or family members out there pushing a swing. So we had to close the playground equipment. Now our large parks, they are still open, but we do have a number of small parks that are closed. And I want to be very clear and specific about which ones, and I want to just read them off to you so that you know. For our small parks, we have, let's see, I think we have a number of smaller parks that are continuously closed. And those are Adventure Playground, the Berkeley Skate Park, the Gabe Fields, King Pool, Shorebird Park, Nature Center, and the Tom Bates Regional Sports Complex and West Campus Pool. So those are some of the recreation things that are closed. Now, in terms of the parks that are closed entirely, we've got 63rd Street Mini Park, Bateman Mall Park, Becky Tomiko Tot Park, Charlie Dore Mini Park, Grizzly Peak Park, Haskell Mabel Mini Park, Ohlone Dog Park, Price Street, and Virginia McGee. But we still have a large park green space open to the community, but you must practice the best social distancing that there is available, please. The goal again is to reduce the amount of contact that we have with each other.
Just to follow up, School Board President Judy Appel wanted to note that the school district has decided that schools will be closed until May 1st at the soonest. And so school playgrounds will not be open for the reasons that the city manager stated, to ensure proper social distancing and to make sure that we can keep our children and our families safe during this time. But there are many other ways that you can get outside and get access to fresh air and enjoy nature. You can take a walk, you can walk your dog, visit many of our regional parks and those parks that are open in the city of Berkeley. And if you go to cityofberkeley.info/coronavirus, cityofberkeley.info/coronavirus is a very comprehensive page with information about all the city facilities that are open, city services that are being provided, and up-to-date information about our response to coronavirus. So I'd now like to go to Councilmember Cheryl Davila, who I understand we have on the line.
Thank you, Mayor. Can you hear me?
Yes.
I hope so. So I just wanted to thank you, Mayor, for holding this town hall. Thank the city manager and the public health officer, Dr. Hernandez, and a huge, huge, huge thank you to all the essential workers, the grocery store workers, the city employee EOC staff, and all the disaster workers. This is something that we've never had to face before. COVID-19 pandemic is really devastating and horrific an event, but we have to maintain this shelter in place, which is presenting many challenges for individuals. But we have to just try to build the relationships within our households and take the time that we can to reach out to people since we're at home and looking for things to do sometimes, although I've been super, super busy on Skyping and Zoom. But we do need to reach out to the people via telephone, virtually, however you can do that, just to make sure and check in that people are being supported in the ways that they can at this time. And remember to wash your hands frequently, keep the social distancing, physical distancing, and there is also a time that domestic violence might be escalated. So I just wanted to shout out the number for domestic violence. It's 800-799-7233 if you're needing assistance in that way. And spend this time wisely. Try not to overspend because the economy is not doing as well. And again, I wanted to thank you, Mayor, and everyone. And I think we should practice the applauding the essential workers every night at 7 p.m. as they are doing in other countries around the world. This is a world pandemic, so we have to take the time to really do what we can, stay calm, and just stay inside. Thank you very much, Mayor. And also, Mayor, I would hope that we put more porta potties next to these hand washing stations since all the businesses are closed.
I strongly agree, Councilmember. And thank you for joining us, Councilmember Cheryl Davila. I'm going to go to John, who's been waiting very patiently. And John,
very patient.
Thank you so much for joining us.
Yeah, I'm really looking forward to it.
John, do you have a comment or a question you'd like to share with our panelists?
Oh, let me just ponder what I want to ask. Okay. let me hear some of the things you say.
Okay, so we decided to go to you to see if you had a question.
Oh,
I can come back to you if you'd like, but you're live. So we're trying to get through as many people that are waiting to be able to answer the questions. So if you have a question, this would be the best time to ask it.
So how do I hear it when I'm off?
I will.
Because I was hearing nothing.
Yeah, I will tell you. So you're live now. I will tell you when we're going to another guest, and that's when you're not going to be live, but you are live.
Okay.
So do you have a question or comment you'd like to share with us?
I'm still thinking about it.
Okay, we'll come back to you, John.
Okay.
That's okay. So I'm going to go to Councilmember Lori Drosty, who I know has been waiting. Welcome, Councilmember.
Hi, thank you so much for having this town hall. I know it can be challenging. I want to thank you, Mr. Mayor. I also want to thank Madam City Manager and Ms. Hernandez for having this town hall. Thanks to all the people who are essential workers. We appreciate your service, and thank you to the rest of you for staying home to save lives. A couple of things really quickly. I wanted to just make sure that everyone knew that the city of Berkeley set up a personal protective equipment donation website. So I joined a little bit late today, so I'm not sure if that was mentioned. I'm sure the mayor will mention that, or the city manager. A lot of people have reached out to me to ask how they can donate those extra masks they may have. And the city has now set up a website in order to track those voluntary donations. So thank you for that. Also, some of you have mentioned that they're very curious which East Bay Regional Parks are open. I want to encourage you to go to ebparks.org in order to figure out which one of those regional parks will be open or closed. And one question I'd like to ask Ms. Hernandez, if that's okay, Mr. Mayor, if she could elaborate on, and that is if someone suspects that they are infected with COVID-19 or a loved one is infected, can you run through what one should do? Because I just want to make sure that people understand how to prepare for this virus. And thank you everyone for staying home and being safe. We appreciate all of your service, especially to the essential workers and the city of Berkeley. And we appreciate you all. Thank you.
Thank you.
So ready to answer the question. You want me to answer? Can you hear me?
Yes.
Oh, great. So the common symptoms for COVID-19 are high fever, so fever over 100 degrees, shortness of breath or coughing, and sometimes people get sore throat and some of the similar symptoms that you would have for flu. Most people, about 80%, have mild symptoms. So what we're asking is that people stay home. They can call their healthcare provider to get advice, especially if you have other health conditions that make you higher risk. Usually those conditions include heart problems such as high blood pressure or other cardiovascular disease, diabetes. If your immune system isn't working normally because of a condition such as cancer or other immune diseases, then these are the conditions that put you at higher risk for getting complications, though we know that this disease impacts everyone. So I would say first, if you have those symptoms, call your medical provider to discuss what you should do safely, but 80% of folks should be able to stay home and not require additional medical care. That being said, I know there's a concern about getting tested. And there are a number of primary care providers in the community that are offering tests, which include Sutter Urgent Care, Lifelong Medical, Kaiser, John Muir. those facilities are offering testing in the community, which includes Berkeley as well as Oakland and other local cities. We are hoping to set up a Berkeley specific testing site in the next week or so, because we know that we need to offer additional testing, and it will be a private-public partnership so that we can expand the number of tests in their city. We will be offering that for the general public, especially those in the communities that have no other form of access, such as those that are unsheltered, those that do not have a regular healthcare provider, and that are higher risk because of mental health conditions, if they live in congregate settings, which includes living in group homes or encampments, or other situations that put people grouped together. So hopefully that answers your question. Happy to talk more about those opportunities later on.
Thank you, Dr. Hernandez. We're going to go to Evan. Welcome.
Hi, everybody. Thank you so much for your time. I appreciate it. I wanted to find out, especially from Dee, a little bit more about the decision to close the basketball courts. We have to balance mental health with physical health, and the 6 feet rule is sort of an outdoors and indoors rule, although it's a bit conservative outdoors and maybe a bit liberal indoors. So could you talk about how you all address that balance?
Absolutely. Hi, Evan. Thank you so much for joining us today. So this was a difficult decision because I do believe that exercise and having recreation during a time like this is really important for families and children. And it's a way for young people to get together and to just kind of share experiences. And there are lots of games that you can play, of course, on a basketball court where you can actually maybe maintain a little bit of social distancing, but we can't monitor it. We can't make sure that it stays that way. So one of the decisions that part of the methodology in looking at this was, hey, how can we, number one, and I'll repeat this over and over again during the conversation, is how do we reduce the footprint of what's going on in terms of shared spaces? So a basketball court where people are running around playing, throwing basketball hoops and having a good time, high-fiving, that cannot happen. So we had to find ways. Initially, we thought we'll leave the basketball courts open, see if people can maintain some social distancing. We observed, we watched, and we found out that it just could not happen. This is one of the locations in our recreational activities and in our parks is where most people can actually touch one another. Basketball is a very physical sport. And again, I know there are games that you can play in basketball that aren't quite so physical, but I can't monitor and reduce it for every single entity that comes out and plays basketball. So unfortunately, we did have to close the basketball hoops. I hope that answers your question. And I love basketball. So I would have loved to have kept the basketball courts open, but I'm more concerned about health and safety of our community. And I hope that's responsive for you.
Yes, that was very clear. Thank you.
You're welcome.
Okay, thank you. We're going to go to David next. David, you're live. I see David. We're trying to connect David here. Before we go to David, let's go to Siobhan.
Oh yeah. Hi. Yes.
Hi.
Hi.
Welcome.
So Siobhan and I both have questions about hand washing stations at People's Park, and also making sure that those bathrooms are properly being maintained. A lot of people rely on them. Food Not Bombs feeds people there 5 days a week. It's pretty important that we have proper hygienic, definitely hand washing stations, and the bathrooms should probably be open at night and stocked with toilet paper. The other thing is can you please put pressure on the governor to do a real rent moratorium, requiring undocumented people and very poor people who don't trust government to apply to a relief fund. It's just frankly punitive. You know, the landlords that are in distress can apply to your relief fund, but the renters need a moratorium. Toot sweet. If it's not April, it's got to be May. Okay, thank you.
Thank you. I'm happy to address those issues. First, I actually agree with you that we actually need stronger action on the part of the state government. And while I appreciate the governor's taking these initial steps, we need rent relief and we need eviction relief now, and we need it statewide. We're fortunate in Berkeley have some of the strongest eviction protections and rent control laws in the state of California, but there are many cities not like Berkeley who don't have those policies, who are going to be adversely impacted by the recession that we've already seen happen and the rise in unemployment that we've seen. So I have actually signed on to a letter that has been signed on to by over 100 housing rights organizations and legal providers, calling on the state of California to not only institute a moratorium on commercial and residential evictions, but also to provide rent relief for residents in the state of California, and foreclosure relief as well. And so we're hoping that the governor will take additional actions to provide protections, essential protections for people who are really struggling during this crisis.
Why not a rent moratorium? I mean, it just doesn't, relief, my thing, what I'm saying here is that relief requires people to go through a paper process,
Yes.
jump through hoops, what the poor are always forced to do. And it's like, could we get relief from that? Could we just get
so let
on rent?
me answer your questions, because you also talked about bathrooms at People's Park, and then I want to go to the next caller. So yeah, I mean, I think there should be a moratorium on rent increases during this time, and that does require state action. Unfortunately, we cannot do that on the local level because of federal and state preemption. So I want you to know that the actions that we've taken to establish a moratorium on evictions.
No, not rent increases.
If I can answer your question, thank you. So I understand what you're saying, and we are going to have to push the state legislature to take that action. Now, and the governor to take that action. To your question about the bathrooms at People's Park, we've actually received several emails from residents about this, and we are in touch with the university about making sure that they can, make sure that they are in decent shape. So I want you to know that we have responded to that. We are in touch with the university, and we do need to put more hand washing stations at various locations in the city of Berkeley. Right now, we have roughly 22 hand washing stations in the public right of way, and our goal is to try to increase the number of hand washing stations. So thank you for calling. We're going to go to the next caller.
Thanks.
Thank you. Is David live? David? So why don't we go to another caller? And while we're connecting somebody else, let me address some of the written questions that we have received. So we received several questions around businesses. What can we do to help different types of independent contractors and local businesses? And so one question is, what help will self-employed people receive, such as gardeners, acupuncturists, hairstylists, waitresses, waiters, and many more? I think we touched upon that in response to a previous question, that people who are self-employed or have one or two employees would be eligible to apply for funding through the Berkeley Relief Fund, but that due to the $2 billion package that the Congress adopted just this week, that those independent contractors will also be eligible for unemployment assistance, as well as for some of the stimulus relief that will be provided. So now, how long is that going to take to get to people who need help now? We need to follow up with our federal officials to make sure that that relief is flowing to cities and to residents as quickly as possible. But at least in Berkeley, we do encourage you to apply for the Berkeley Relief Fund. A good suggestion, could the city make a database for local businesses that we could prepay as a way to provide support for local businesses? That's a great idea. We will look into that, and I want to thank you for suggesting that. How can we keep our food business employees protected from COVID-19 during in-store financial transactions? This individual noted that in Italy, they put up plastic barriers at registers between employees and patrons. That's a good question. I don't know if Dr. Hernandez, there's been any guidance or directives around social distancing or protections for essential employees in the food service sector, hotels, et cetera?
The city of Berkeley has guidance for businesses on our website, and there'll be more information about for businesses and retailers in particular, such as those such as stores. There has been a question about what are we doing about the shelter-in-place order and what's going to happen next. And one of the things that we're looking at in terms of the impacts of the shelter-in-place order is it working? What needs to change, if anything? And one of the things that we've noticed as health officers in the region, that there needs to be more support to retailers and stores in general with specific guidance to ensure that not only the patrons, but those that work there are protected. So those are coming soon. One of the suggestions I would say in terms of transactions is if we could limit it, and I know this is not reasonable for everyone, but if we could limit those transactions to credit cards, so there isn't that transaction from hand to hand for people and the cashier, that would be one. The other is if we could have hand sanitizer for the workers at their cashier site, and also wiping off the high touch areas in between each transaction if possible. So there are certain things that we're going to suggest in the coming days that are going to be part of the shelter-in-place recommendations from the region.
Thank you very much. Go to a couple more written comments before we go to the next caller. There were some questions around people that are in the gardening and landscaping business, particularly somebody who has a landscape design firm. How does the shelter-in-place order apply to them? And namely, how could they be able to continue to conduct business but ensuring proper social distancing? And I guess that is a question, I guess, related to, whether gardening and landscaping is an essential business, and if it is, what measures people can take appropriately. So Dr. Hernandez or city manager, I don't know if you can shed some light on that issue.
I'll take that. Most landscaping and gardening is not considered an essential business. The businesses that would be considered essential, or the activities that would be considered essential for a landscaper or a gardener, would be those that would protect the safety of a property or an individual, such as maintaining foliage or any sort of grass or trees that need to be trimmed in order to protect from fire hazards or dangers for a home or a business, so that we prevent any damage or damage to property or individuals.
Okay, thank you. And one last question. There have been a couple of questions around whether the city will continue to allow medical and recreational cannabis businesses to operate. And I'm wondering if either the health officer or the city manager can talk about what regulations we have in place around cannabis businesses.
So I can certainly answer the call. The regional health officers have worked really long and hard around this issue, and we've tried to take a very concerted approach and a very regional collaborative approach to addressing some of the challenges around cannabis. At this time, yes, cannabis businesses can still operate. There is not a total shutdown of cannabis business operations. What we're looking at is, again, reducing the footprint to where we don't have a lot of people making contact with each other. So what's available for cannabis operations, cannabis businesses today? Cannabis businesses can deliver both medicinal and recreational marijuana, and they can provide curbside medicinal marijuana as well. That's here in the city of Berkeley. But I do want to point out that in other jurisdictions, and you'll want to familiarize yourself with other jurisdictions and their protocols because they are varying. They're still pretty tight, but they're varying across the region. So that is for the city of Berkeley. Again, curbside is available for medicinal, and delivery and is available for both medicinal as well as recreational. And I want to thank the health officer and her team and the folks that she's been working with across the region to make that determination and to make sure that we're approaching this from a very fair and practical way. So thank you.
Okay, thank you. So now going to go to our guest who's been waiting patiently.
Sorry about
Welcome.
that.
Hi, good afternoon, and thank you so much for hosting this call. I actually would like to ask a very important question, and a lot of people on the chat have been asking this question about the link between animal exploitation and pandemics. And we know that, from research and from science that, viruses like coronavirus, like SARS, the Spanish flu, many other outbreaks, these are all zoonotic pathogens, and factory farms are the brewing grounds for these pandemics. So I really want to ask what Berkeley is doing in acknowledging the link between global pandemics and animal agriculture. And I really would like to urge Berkeley to become the first city to move away from spending any city funds on animal products, and if we can all take a very strong stand against animal exploitation. I really appreciate any response to that. Thank you.
Thank you very much. Thank you for calling in and waiting patiently. As you may know, Berkeley has long been, at the forefront of advocating for the humane treatment of animals. And actually, most recently, I think in response to a resolution that your organization brought to the City Council relative to nonviolent civil disobedience that animal rights activists were engaged in to protect animals who are engaged in factory farming. The City Council took a pretty strong stance against factory farming and cruel husbandry practices against animals. And I think we believe very strongly in ensuring the humane treatment of all people and all beings, including animals. And so I appreciate the advocacy that your organization has been involved in and really shedding to light this issue. And we will continue to speak out. So thank you. So we're going to go to Joe, who's next on the line. Hi, Joe, you're muted. If you can unmute yourself. Thank you.
I'm so sorry.
Hi.
How about now?
I can hear you. Yes. Thank you.
Thanks. I really appreciate you talking with me, and I really appreciate all the tremendous amount of stress you must all be under, just working so hard to try to control all the uncertainties about click on law for a second, but I'm a tree guy and I do a lot of pruning, and I do a lot of fire pruning in the hills as well as other safety pruning. And I was just wondering if tree work specifically around hazard reduction is exempt from shelter in place if you're obviously doing the 6-foot thing and you're hand washing constantly and you're going through the normal protocol. Is that exempt from the shelter in place order?
Thank you for that question. I'm going to go to the city manager. Would you be able to answer that?
Absolutely. Thank you, Mr. Mayor. So, hi, Joe. Thank you for joining the call. And yes, at this time, a few moments ago, Dr. Hernandez gave some information about specifically about hazardous removal of green waste and other shrubberies and large and tall trees. At this time, it needs to present a hazard. So if it's presenting a hazard to people, to homes or businesses, yes, it is permitted because it needs to be essential. The function needs to be an essential reduction of some type of hazard. So at this time, for beautification, no, but to reduce some type of environmental condition that would affect a person, property, yes.
Thank you.
Thank you, Joe, for joining us. I'm going to go to Dale. Dale, welcome. Dale, you there? Dale, if you are muted, if you can unmute yourself. Okay, Dale, we'll come back to you. Let's go to Lisa. Lisa? Okay, let's go to Thomas, it looks like. Thomas, welcome. You are live. We'll come back to you. Let's go to Lisa. Lisa? Okay, let's go to Thomas, it looks like. Thomas, welcome. You are live. We'll come back to you. Let's go to Lisa. Lisa?
Quarantine workout. Wash your
Please forgive us as we're trying to connect people. This is the first time we've done this, and we're going to definitely do this again. And I just want to note that we've gotten a lot of written questions that we will provide written responses to and post them on my website. And this video is actually going to be available on our Facebook page, and we'll link to that on Twitter as well, so people can access the video. So let's go to Matt Johnson. Matt, you're live.
Hi there. Yes, thank you so much for speaking with me. I'm with AP, who was on a minute ago asking about animal agriculture. It cut out a little bit, so I'm sorry I didn't catch your whole answer there a little bit, but I caught most of it. But I'm saying similar things to what she had to say. I do appreciate what the city has done with the resolution and support of the nonviolent whistleblowers. Thank you so much for that. And that did take some courage, and y'all did the right thing with that, with the fur ban. And so Berkeley has, Berkeley was the banned the sale of fur, and that led to the California doing so. So I do want to acknowledge Berkeley has led the way and has done great work for helping animals. But I do want to also emphasize the urgency of this moment, and we could face another pandemic in the future, which could be 100 times worse. So I really want us to move in that direction of really divesting from it the same way that, you know, we divest from the fossil fuel industry, and everybody gets behind that, and rightfully so. And animal agriculture poses at least as dire a threat to the future of all life on this planet. So I just wanted to elevate that. So thank you very much.
Thank you. So we're going to go to Rebecca. Rebecca, thank you for joining us. Can we queue up Rebecca Williams?
Fuel industry, and everybody gets behind that, and rightfully so. And
hi, Rebecca.
At least as dire a threat to the future of all life on this planet. So I just wanted to elevate that. So thank you very much.
Thank you. So we're going to go to Rebecca. Rebecca, thank you for joining us. Can we queue up Rebecca Williams?
Fuel industry, and everybody gets behind that, and rightfully so.
Hi, Rebecca.
Dire threat to the future of all life on this planet. So I just wanted to elevate that. So thank you very much.
Thank you. We're going to go to Rebecca. Rebecca, thank you for joining us.
Oh, hi.
Hi. Why don't we come back to Rebecca? And is there somebody else? Actually, we're going to go to. And so if we can just, I want to address a few of the written questions that we received. One of the questions, and this is a question for the city manager, and I'm happy to elaborate on it, is how is the city's budget being impacted by the coronavirus crisis? And I think that's a really good question. I think at this time, you know, we don't know what the full effect of this crisis is going to be on our revenues and our city budget, but I know our staff are monitoring very closely. And Madam City Manager, if anything you want to add on that?
Yes, so, you know, clearly we get revenues from various sources in the city. A huge amount of our revenues come from sales tax, as well as property tax, unsecured tax. We have quite a few revenues that come in. And one of the things that we're going to be looking at over time is what things do we need to do right now in terms of measures to reduce our future impacts and to address any shortfalls in the revenue. So we're going to be looking internally first. So we look at what things can we minimize. Can I freeze positions? Can I look at reducing the number of times we water parks? What can we do? So we're going to look at all these amazing things that we do now that we may not necessarily need to do, and consider those. And then we look at what revenue streams are being hit the hardest. How do we bolster those up? What kind of support do those revenues need? We look across the organization at our vacancies. We really scrutinize the hiring process and what things are in the queue what positions are in the queue to be appointed. And then we take like a really comprehensive look at those mandated services and those services that may not necessarily be mandated to do, just to get an idea. But let me just say that we won't know any of this until probably sometime September or November. But my goal is to start planning early, look at short-term, midterm, and long-term strategies so that we can address this issue and stay in front of it, and pull back where we need to pull back and address things that are critical and important to services in Berkeley, and making sure that our community get those services.
Thank you, Madam City Manager. I'm going to go to Dr. Hernandez for a few health-related questions. We got a number of questions. So first is, will the shelter-in-place order be extended beyond April 7th? I know that there's a lot of discussion right now about looking at the data and really trying to decide what the next steps are.
As I mentioned earlier, we're in discussions now, myself and the 6 other health officers and the respective city attorneys and county councils that came together to issue the original order. And we're looking at the impacts of the shelter-in-place order, as well as the what's happening in terms of disease, in terms of cases that are happening within our own jurisdictions, and also globally. So we're in discussions now. We hope to have something out by early next week in terms of the next steps for that order, whether it will be extended or not. So stay tuned for that.
Great, thank you. A couple of other questions. So there have been a lot of questions around testing, and specifically, are there locations in the city of Berkeley available for testing? Is the city actually looking at expanding testing capacity so members of the public can get tested? There were many questions related to that. I just wanted to highlight. So where can you get tested in Berkeley? Are we looking at expanding access to testing? What is also being done to address the shortage of PPE for frontline hospital workers and ventilators as well?
Okay, so I'll do the testing question first, or questions. There are several places within our area, Berkeley and outside of Berkeley, that are offering testing. Those include Sutter Urgent Care on Milvia, John Muir, Kaiser, and some sites for lifelong outside of Berkeley that are also offering testing. The criteria for testing in those settings are set by the healthcare providers that are offering the testing. I believe most of them are using the CDC criteria for those that are highest risk because the availability of testing is still low. That being said, the city is exploring offering a on-site or within the city of Berkeley testing, so that will be available to our residents, especially those that do not have access to testing in those areas that I mentioned already. We also want to prioritize healthcare personnel and first responders to make sure that they're being tested so they can protect us. So they're protected so they can protect us and take care of us if and when we get sick. And then the last question, I don't recall. Can you repeat that, Mayor?
There was a question about what is the city doing to address the shortage of personal protective gear for frontline hospital workers, and Is there a shortage of ventilators in Berkeley or in Alameda County?
So one of the other things that we're doing as a region, and actually the state is doing, is looking at modeling. Modeling entails looking at what disease impacts have already occurred within our jurisdictions or in our state, as well as the trajectory of disease based on what we've seen in other countries and other jurisdictions that have had the impact of COVID-19 already. We use that and we plug it in to what our current healthcare system has available to us in terms of hospital beds, ICU beds, as well, and ventilators. And it's no secret, unfortunately, if we continue on the trajectory that we have seen in other jurisdictions, including New York and Washington State, there will not be enough ventilators and beds to take care of our residents. And that is why we instituted early and aggressively the shelter-in-place order. That said, we are not standing still in terms of seeking resources and supporting our hospitals to get the PPE and the equipment they need. As I mentioned earlier, we are having daily meetings with the healthcare facilities in our community. We're working within our region and within the state to locate those resources, which include opening hospitals in our area that haven't been used for some time. So we're working as fast as we can to assure that we're caring for our residents.
Thank you, Dr. Hernandez. We're going to go to a caller now. Doug Jones. Doug, are you there?
Yes, I am. Yeah.
Hi, welcome.
Yeah. I really appreciate you running this forum. It's very, very important that the citizens and the community are very well informed about what's going on. So,
thank you.
So one of the things that we've been struggling with, and we agree with Dr. Hernandez that it's really important that frontline workers right now, first responders and healthcare workers, are getting the maximum in terms of testing and other types of things. Obviously, people that are symptomatic are particularly important to highly prioritize right now, but it's important that we know when healthcare workers have become infected with the virus, so that ideally we're putting in best practices to keep them safe from other healthcare workers, other first responders, and the public. But another thing that our healthcare workers are struggling with, that we represent at Ultivate Summit and many other facilities in and around the Berkeley area, is childcare for first responders and for healthcare workers. In a survey of our members that we ran last week, over a third of our members answered that they have actually had to call off of shifts at their workplaces, at their hospitals, at their clinics, because they can't find childcare. It was necessary to close the schools. But it's a completely unprecedented and the type of expense and inconvenience that our healthcare workers could not have expected to plan for. So the city of San Francisco, Sacramento, other cities, and in Marin County, they actually have set up free, safe emergency child care services for first responders, healthcare workers, and other high priority workers. I'm not sure where the city of Berkeley is on that.
So I guess that'd be a question around what are we doing around providing child care for first responders in the city of Berkeley and other essential city employees. So
that's correct.
Madam City Manager, I know that this is something our EOC has been looking at, and I'd like to go to you now, if that's okay.
Hi, Doug. Thank you for joining the call. And yes, the city of Berkeley has been working very diligently on trying to pull together regional support, both with Alameda County as well as locally. So locally, we're looking, we've sent out a survey to all of our first responders to find out where the needs are for, and these are the essential service workers for the city of Berkeley at this time. We sent out a survey for those essential workers to determine what the need looks like, so that we have an idea idea of what our capacity is. We're also referring people also to the Alameda County because they are doing the regional county work around securing childcare for families, especially those that are in the health profession, as well as those that are essential and first responders. So right now we're localized for essential workers and first responders for Berkeley. So our specific efforts are there. And we're also working regionally. So if you go on the website, I believe Alameda County's website, they have some information up and running regarding their available health childcare support services for families that are first responders.
That would be pleasantly surprising for me to know, because I will just say that I've had conversations with Ellen Dektar with Alameda County Early Care and Education Program and other people at the county and city levels in Alameda County. And it's been surprising to me that it doesn't appear as though a county-wide plan or a plan that's substantially put together in many cities has been finished and put together. I'm actually hearing from Ellen Dektar a fair amount of explanations why we can't put together an immediate free emergency childcare services for first responders and healthcare workers. At least that's I'll just say that's my general impression. We don't have something in Alameda County, which has been manifested in San Francisco City and County and Marin County. And it sure would be great if we could get over the finish line on that as quickly as possible, because we need our healthcare workers to work all of their shifts right now at hospitals and clinics. There's got to be barriers that are shoved away for them to be able to complete their shift work right now.
Thank you, Doug. I really appreciate you calling in and raising that really important point. We're going to go to Donna next. Donna? Hi, welcome. And Donna, are you have you unmuted your phone or computer? Donna, why don't we come back to you? We'll go to Rachel. Rachel, hi. Rachel, are you there? Or Don? Okay, why don't we keep you there? I'll read some more written questions while we're trying to connect with people that are calling in. So another question for Dr. Hernandez relating to some of the health impacts. One question that we've gotten is, has there been a death due to COVID-19 in the city of Berkeley?
There we go. There has not been a death in the city of Berkeley. We would announce that. We do have people who are hospitalized, but not anyone who's died. There have been 4 deaths in Alameda County, and I believe about 78 deaths noted in California overall.
Thank you. Another question. I've gotten a lot of questions around, I'd like to know if my neighbor has contracted the coronavirus, and can the city let people know where are people sheltering in place, or more specific information about the individual cases. And I know that there are federal limitations under HIPAA around what information can be shared. And so, Dr. Hernandez, I'm wanting to ask you to address that. What information can the city share? Why can't we let individual neighbors know that their neighbor is infected?
As you mentioned, Mayor, there are privacy laws that medical professionals and public health have to adhere to. So we don't share information about individuals' diagnosis, whether it's COVID-19 or any other disease. That is not something that we normally practice. Rule of thumb, what we share is when we're able to, we share information that we feel is necessary for people to know to protect their own health. So we have the number of cases on our website. We are looking to provide more data, so you may see some more information coming soon, but we will never provide information about an individual's identity to anyone in the general public.
Okay, thank you. We have Abigail. Hi.
Oh, hi. I just wanted to watch it. I don't really have a question. And I just
Okay.
couldn't get on anywhere.
Thank
And
you.
I gave up and I was watching Netflix and all of a sudden you came on. So please don't waste any more time.
Okay, thank you. Thanks for tuning in. We'll go to Helen next. Helen.
My audio's on. I had an hard time even trying to get to the town hall. Your Facebook page has you having to log on, so I couldn't get connected. My concerns are about access to our seniors and persons with disabilities and our unhoused and most vulnerable population during this time of crisis. Is how are we going about organizing our nonprofits and different areas to ensure that we have as much as possible to offer them to be as safe as they can, are unhoused, making sure they have washing stations that are accessible, porta potties that are accessible, as well as potentially being able to get some shelter and housing either in our hotels or if buildings we have available where we might be able to do that better. So my overall concern is we're at the peak of the crisis in the next 2 weeks. I'm just basically concerned, you know, our seniors don't have access to a lot of shopping areas. There's been people saying that they can't get shopping, trying to figure out how to use online resources to understand how to do that. So just kind of putting it out there. I'm available to help and volunteer my time any place possible, but is really concerned about our most vulnerable population.
Thank you. Thank you, Helen. Thank you for your service on the Commission on Disability as well. Madam City Manager, I'm going to go to you around that. I know that we have a team in the EOC, particularly working on how to serve vulnerable populations. And, you know, we also got a lot of written questions around what is Berkeley doing to address the needs of people experiencing homelessness who may not have access to housing. And what are we doing also if those people do test positive for COVID-19? So could you maybe elaborate a little bit about what the City of Berkeley is doing around addressing the needs of our seniors, persons with disabilities, as well as people experiencing homelessness?
Yes, thank you, Mr. Mayor. And hi, Helen. Thank you so much for joining the call with us. So we've been really working hard on this. We have a full dedicated team in our EOC that's linked with multiple other community agencies, other regional efforts, and we're trying to mobilize as quickly as we can. So here's some things that we've done so far. We've increased our Meals on Wheels for our seniors. We're doing direct outreach to our seniors to make sure that they have access and they have information that's available to them and how to receive services. We're also worried and concerned about their isolation, because I think one of the things with this shelter in place is that people actually are not able to come out and socialize with the folks that they're normally used to working with and having fun with and talking to. So we are doing different things around how do we outreach to our seniors, and that's happening today. In terms of our homeless community, I want to say this has been the biggest lift. We've called every single hotel in the city of Berkeley. We have secured a number of hotel spaces with some of our hotels, and we're looking to secure even more. We have a home that we've secured and we're renovating it. It doesn't need a lot of work, but it has 4 bedrooms in it. We're going to be utilizing that home as well. We are increasing the number of shelters in Berkeley. And also we're looking at purchasing, and we've already purchased, but they'll be coming in soon, 8 trailers. And we're also in a regional effort with Oakland to bring in additional trailers, maybe up to 10. So the mayor and I have been talking a lot about where in Berkeley can we put our trailers, where can we house folks. So we're going to be looking all over the city. We're going to be addressing how we look at Measure L and the restrictions, and if we have the ability to to lift those restrictions in an emergency so that we can park trailers in our parks and find a way for people to have access. Now, those trailers will be used for people that have been COVID-19 positive. They'll also possibly be used, depending on where they're located, for people that are just frail or maybe disabled or seniors or whatever their needs are from part of our most vulnerable in Berkeley. So we're doing so much, and I know it seems like it's snail time, but it's coming, and we are working on it. I'm very proud of the teams that are working on it, and also the volunteers that are out there. I don't know if you know, but there are so many amazing volunteers. Now, while we don't want their footprint out there and moving around and delivering things, as long as they're practicing social distancing at its best, we do want them to continue because one of the other things that we've noticed, Helen, is that what I think it's called, and I always forget the term, but it's where there are food insecurities, where our encampments aren't getting the normal amounts of flow for food and nutrition. So folks are working hard. We're working with the Berkeley Food Network and getting more food and out to our homeless community. So I hope that answers your question. And thank you so much, Helen, for calling in.
Thank you, Helen. We're going to have to go to the next caller, but I'll just note as well that we are working in coordination with many of our nonprofit organizations to make sure that they get access to hand sanitizer, resources, access to meals during this time. And we welcome any suggestions about opportunities for additional partnerships. So we're going to go to Dana. Dana, you are live. Dana, are you there? Dana. Well, while we're waiting for Dana, let's go to Bryce. Bryce.
Hello there.
Hi.
Hello, Mayor. So there are certain professions that have a lot of contact with people. One of that would be supermarket checkers. What discretionary tests does the health department have? Where are those tests being used? And would it make sense to test supermarket checkers and other people who contact a lot of things or people that we touch? Supermarket checkers are touching basically all of our food.
That sounds like a question around testing, so I'll go to Dr. Hernandez.
Yes. So the health department or health division does not have any test at this time. We don't perform the test. We rely on our healthcare providers in the community to do those tests. I did mention that we're hoping to have an on-site testing clinic in the city of Berkeley in the next week or so, and that would be a public-private partnership. So there will be additional testing capabilities here in the city of Berkeley. In terms of testing individuals, we currently would want to test those that are symptomatic. And I understand your concern about those individuals who are essential workers that are out in the community. I worry about them as well. And if they are symptomatic, we want them to get tested as soon as possible. That said, if someone is symptomatic, especially with the symptoms of COVID-19, the fever, shortness of breath, coughing, they should stay home when they're sick. And that's the advice that we give for COVID-19 and for any other disease. If you're sick, you should stay home. But I do understand your concern, Bryce, about additional testing, and that's why we're hoping to get something available on site in the city of Berkeley as soon as possible. I think you have to unmute yourself.
Is there anyone who's doing pooled testing? In other words, say, take an entire supermarket checker team, take a swab from each of them, and combine them into a single test, if tests are so precious at this point that they can't be used for asymptomatic individuals. There was an Israeli study recently, they were successfully able to do 32 and 64 pooled tests.
That's a really interesting question. I don't know if that is being done at this time, Dr. Hernandez. Do you have any information to share?
I'm not aware of that happening in the city of Berkeley or any other areas. But yeah, definitely interesting, and it definitely would provide additional information on the behavior of this disease.
Both information and a sense that a particular place, like a particular supermarket, is not safe to visit, but safer, that there's not an asymptomatic super spreader touching a lot of people's food.
Thank you, Bryce. Thanks for
Thank
coming
you.
in and for your questions. We're going to go to Lisa. Hi.
Hi, can you hear me?
Yes.
Hi, so thank you so much for all you're doing and all the hard work that the city staff is doing. I know we've been in touch with you about this, but we're also concerned about the lack of open space for people in the city of Berkeley, the closure of the parks and the playgrounds and the schoolyards, resulting in a lack of place for people to walk. And currently the sidewalks in Berkeley are very crowded with people, especially with young children and older folks who are trying to get outside to get some exercise, and also for mental health well-being, to be able to get out of their homes. We recognize that social distancing is important when people are outside, and we're just wondering what the city can do to increase the amount of space that people have on the sidewalks, in terms of possibly having some street closures and other possible opportunities to allow people to pass at a safe distance. Thank you.
Thank you. Madam City Manager, I'm going to go to you for that question. I'm happy to elaborate as well. That's okay.
Absolutely. Thank you, Mr. Mayor. And thank you so much for calling in, Lisa. So clearly the toughest thing happening right now for unhoused is trying to ask people to move right now. Now the sidewalks is one thing, because I do believe that people should move from the sidewalks whenever possible, because we all need to have access to those sidewalks, and we will continue to do our sidewalk ordinance enforcement. It's very low key right now, but we are still doing that. The displaced.
Sorry, I wasn't actually asking about the displacing people from sidewalks. I was asking actually about providing more space to pedestrians on sidewalks to allow people to get out and walk around more without. Our sidewalks are often like 4 feet wide, and there's no possible way to practice social distancing. And I'm a member of Walk Bike Berkeley, have been asking for some street closures to allow people to pass at a safe distance without having to risk themselves, as cars are still driving on the streets, albeit at a lower volume, often at a higher speed right now. And we're asking for some street space to be reclaimed for pedestrian access. Thank you.
Yes, thank you. And I did get an email from, I think there's a couple of folks that I've gotten a few emails from regarding increasing the sidewalk space. And I know that is an important thing. And I've tried to be responsive about that and responded to, I think it was Liza. So I'll just share with you some of the information that I've shared with Liza. So the idea of reducing sidewalks and roadways through motor vehicle traffic or people on residential streets and taking boulevards in particular is a good one, even if we currently lack the materials to do so very quickly. Even though much of our operational staff is either continuing delivery of essential services or diverted to other COVID-19 responses, we aren't able to work on some of those things that would help from an infrastructure perspective. For example, we held a multi-departmental kickoff meeting with the engineering and design consultants for the Millvia Bikeway just yesterday. This was a via video conferencing, allowing some detailed discussion around construction and maintenance requirements. So we have several other projects in the works with this shared goal of reducing through traffic on bike boulevards. Based on our experience with the conceptually much simpler Fulton protected bikeway a few years ago, quick build projects have a surprising number of details that must be worked out to ensure that things are safe and effective, and that the layout is clearly communicated to the public prior to what it's changed and what it should be doing during the change. A coned out parking lane may be relatively clear if you have enough cones or barriers and signs to do that. But a floating parking lane without signs and markings may not be so obvious to people wanting to park their cars, and having a safe access for people. Working out and implementing the details takes a lot of resources, but it's challenging at this time when we're deploying folks to different places within the city. But it is a high priority for us to make sure that we're sharing our roadways, our sidewalks, and our streets, and using everything environmentally to address those things through planning and implementation of temporary measures. So I don't know if that answered your question, but we've been trying to address that through just being responsive to emails from the bike and pedestrian community. Thank you.
And Liza, I know that City Manager provided a written response to your question. I think your question's about opening up streets to allow more recreation and to maximize social distancing. And I think that's something that you know, we'll have to evaluate. And I appreciate you raising that. And I am going to have to go to the next caller if that's okay at this time. But thank you for joining us.
Thank you.
So we're going to go to Linda.
Hi, can you hear me?
Yes, hi.
Hi, thanks for doing this. Thanks for everything you're doing, all your hard work. It's appreciated. Two questions. I came on when you were talking about gardening and landscaping, and I wasn't able to get my sound right. So I apologize, but can you repeat that? Can we use our gardener still? And the second question is, I read the order and it talked about construction in the city of Berkeley limited to those construction projects for affordable housing, as well as I think homeless. So were there any other exceptions to construction that's going on in the city of Berkeley?
Thank you. Those seem to be questions relative to the order and what is deemed to be an essential business and which businesses can operate, namely landscaping, gardening, as well as residential construction. And so I'm going to go to Dr. Hernandez or the city manager, whichever is best equipped to answer that question.
So
City manager?
Yes, so I'll try and address some of this for you. So of course, on our website at www.cityofberkeley.info/coronavirus, you can find explicit information about construction projects and what's allowed. At this time, all housing for affordable or housing is allowed. And we've laid out explicit directions on online support services for permitting, for getting building inspectors, and we're doing virtual building inspections at this time. So all of that's available at this time for under this shelter in place order. And specifically again, for all housing, not just affordable housing, but all housing.
Thank you. And the landscaping one?
And so for the landscaping and we can have our health officer chime in here if need be, but landscaping is not an essential service. What we've talked about earlier, was that if it is a service that's preventing harm, hazard to property or people or a business, then those types of services can be provided to our community and or an individual homeowner or business. So, but if it's just to beautify and to make things beautiful in your home, although I would love to get the gardener out right now because it's growing kind of high, but I understand that that's not an essential service. So in terms of having your absolute essential needs met to prevent an unsafe condition, yes, that's available, but anything beyond that is not.
Thank you.
Thank you, Linda. We're going to go to Beatrice and then Mark after. Beatrice, you're live. If you can unmute your line. Beatrice? Well, let's go to Mark and we'll come back to Beatrice. Hi, Mark. If you can unmute your computer or phone.
Oh, thought I did.
There you go. Hi.
Sorry about that. I'm Mr. Mayor. I want to thank the city manager and the health officer, used to be the health commission chair, and I really appreciate the public health approach you've taken in the city. I don't know if my question got answered earlier because I wasn't able to join. How can we as citizens help with Medi-Cal enrollment, with food stamp enrollment, with WIC enrollment for all the people that are newly unemployed in the city of Berkeley?
It's a really great question. And I don't know, Dr. Hernandez or City Manager, you want to help answer?
So hi, Mark. I don't know if I heard your question correctly. So can you repeat your question for me?
Of course. With all the newly unemployed, we now have a lot of Berkeley citizens who are eligible for Medi-Cal, for food stamps, or for WIC, or CalFresh, I guess we call it. And I'm concerned that we might not have enough city staff to enroll as many people as need to be enrolled quickly. And I'm wondering if there's any way citizens can help the city in any way in that enrollment.
So at this time, all of our employees are considered disaster service workers, and we can bring them in for different requirements. So as long as they have the ability to do that type of work or the skill set, we can place them into jobs that aren't normal. So we do have the available staff in place right now to address that type of an issue. But at the end of the day, I think every volunteer, every service that we can get is helpful. So what we've been doing is asking people that want to donate time to send their information in to the city. You can send it directly to me, city manager, and we're pulling that information into a spreadsheet. So if we have to deploy and need people, we'll be able to reach out to you and have you help us with some of these great services and volunteer services that people are offering. So thank you so much, Mark. It was great to talk to you.
Yeah, thanks.
Mark, and that's a really good suggestion. We should really think about how to, with proper social distancing, obviously, but how to really engage people in our community who want to help, who've been either trying to collect personal protective equipment or who can, work in doing direct outreach. And so we are working to try to develop the capacity to have kind of volunteers to help assist the city in our response. And we'll be sharing information about that to the public. So thank you.
Can I add one thing,
yes.
Mayor? I do want to thank everyone in the community who has offered their help or any of their resources for this response. And just a plug out for healthcare workers, there's a disaster health volunteer sign up through the county, through Alameda County, that any healthcare worker can sign up. And if you're a City of Berkeley resident, that's even better. So we can use your resources if need be. And it's a federal process that goes through the county in this case to have disaster health volunteers enlisted. And then if needed, we can deploy them in the City of Berkeley and various healthcare settings. So that's another opportunity, but I do want to thank everyone who has offered either resources, PPE, or their time or expertise during this time.
Okay, thank you. We're going to go to Chimmy. Hi, Chimmy. If you can unmute your phone or computer.
PPE or their time or expertise during this time.
Hi, Chimney. Thank you. Chimney. Hi, Chimney.
I have an address.
Unmute your phone or computer.
PPE or their time or expertise during this time.
Hi, Chimney. Thank you. Chimney.
I'm here.
Hi, Chimney.
I have an address.
Unmute your. I'm sorry about the technical difficulties. I think you're probably playing Facebook, and there's some
Chimney.
Thank you.
Chimney. I have no idea how to correct that.
Unmute your. I'm sorry about the technical difficulties. I think you're probably playing Facebook, and there's some. Okay, Jude. Hi, Jude. Let's go to another person. Kathy is connecting another person. Kathy, are you there? Kathy Pugh. We're going to go to Kathy Pugh.
Hi, sorry about that.
No problem. Hi, Kathy. Kathy, I think you just muted.
Yeah, we just muted.
Hi.
Sorry, a little new.
No problem. We're getting used to this as well.
Very good. Thank you, Jesse.
Kathy, do you have a question or comment?
Actually, I don't. I just wanted to hear your what you had to say of what was going on.
Thank you. We're going to try to do more of these, and thank you for joining us. Really appreciate it. Be safe.
You too. Thanks.
Okay, John. We have John Howard.
Yes, let me kill the audio on this.
Thank you for joining us.
Hi, thank you very much for, can you hear me?
Yes, and I love your background. It's really cool.
Oh, thanks. Thank you very much. It's thanks for doing this. And I have a question about the Berkeley Relief Fund. Can you hear me?
Absolutely. Yes.
Okay, great. Were independent artists and makers considered in the making of the rules and qualifying for this aid?
Yes. So there's 3 different pots of money in the Berkeley Relief Fund. There's funding for providing housing assistance for residential tenants who may be impacted by the crisis. There's funding for small businesses, and then funding for artists and arts organizations. And so starting on Monday, and I think we're still shooting for Monday, but starting on Monday, we are going to be releasing the applications for people to apply for grants, and as well as the criteria. And so you would be eligible as an individual artist to apply for funding through the Berkeley Relief Fund. Thank you. So we have approached the 2 o'clock hour. I know that we have people that have been waiting patiently. I apologize, we were not able to get to you. But I promise you we'll do this again, and we'll do it having worked out all the kinks. And this was kind of a good test run to see how we can use technology to not only answer people's questions, but to directly engage with people in this time of sheltering in place and social distancing. So we will definitely do this again. And I want to encourage those people that did not get their question asked or submitted to please email me at mayor@cityofberkeley.info, mayor@cityofberkeley.info, and we will directly respond to your questions or direct them to the appropriate staff. This is just a list of some of the resources that are available. We encourage everyone to go to the City of Berkeley's page on COVID-19, cityofberkeley.info/coronavirus. And then we also, once again, encourage you to go to berkeleyReliefFund.org, berkeleyReliefFund.org, to not only learn about how to apply, but also to donate. We are calling on everyone in our community, large businesses, residents, philanthropy, to please step forward. This is a really critical time for our city. We need to do everything we can to help our small businesses, our arts organizations, and our residents who are really struggling and impacted by this crisis, to make sure that they can survive, that they can make it through the other end of this crisis. So please give whatever you can, whether it's $1, $5, or $50,000. Any donation would be greatly appreciated and will be matched by the City of Berkeley's contributions to be able to help as many small businesses, arts organizations, and residents as possible. So I want to thank everyone who's joined us. I want to thank our amazing city manager and amazing health officer for participating and for answering your questions. And we'll try to do this again. And this video will actually be posted on the Berkeley Mayor's Office Facebook page, which can be accessed at facebook.com/Berkeley Mayor. And then once we are able to, we will upload it to our YouTube page as well. So thank you all for joining us this afternoon. And I want to let you know that even though City Hall may be closed, we are still working very hard on a daily basis to help and serve our community. And I don't know if anything you'd like to add, Madam City Manager, before we close. You are, I think you are muted.
Thank you, Mr. Mayor, so much for doing this for our community. We have just an amazing community. I can't say enough about the people in Berkeley and how they come together and try to figure out how to help each other. It is such an amazing thing. And when things happen in Berkeley, people respond. And I am very, very, very proud to serve. So thank you. Anytime, this was great. It was wonderful talking to our community members. And Mr. Mayor, my hat's off to you and thank you so much.
Thank you very much. Dr. Hernandez, any final words you want to add?
I want to take this opportunity to thank you, Mayor and Madam City Manager, for your help and support. This has been an unprecedented time for not only the city of Berkeley, the nation and the world, and your support and the community support is very important. Last thing, wash your hands, please, as many times as you can.
Thank you. Yes, once again, wash your hands for 20 seconds. Wash them thoroughly. Please practice proper social distancing, at least 6 feet separation. And everyone, please be safe. You know, your health and safety is our number one priority. And we will get through this as a community together, and we'll be stronger together as a community. And I want to just close by thanking our amazing city staff, some of which joined us today, who've really done an incredible job over the last several months. And we will continue to work on your behalf to make sure that we can keep our residents and our businesses safe and supported during this difficult time. So thank you for joining us, and have a very great afternoon, and please stay safe.